Hi everyone. So we're talking about chapter 4 about birth and the physical development from being born until the first 3 years and just some of the changes that kids go through at that point. It's the time that we grow the most as humans. The most change and development happens in those first 3 years. And so, like it says, we'll be talking about the physical part of it today. So, starting with birth, and we'll talk a little bit about this in class too, because I know you're watching the business of being born. But just as a reminder, prior to the 20th century, so before 1900, birthing was typically done at home. People would use midwives. They would have, not obviously formal training, but most midwives they had like an apprenticeship system. So they would have had a lot of experience with birth, but obviously not in the same sort of medical oriented way that people have now. Death rates were, as you could expect, a lot higher for mothers and babies, and there's a couple reasons for that we'll talk about in just a second. And then we also know that 1 in 4 babies died in the first year, so quite high infant mortality, and it was quite dangerous for the mothers to give birth as well. Then once we get to the 1900s, and antibiotics come around and people start recognizing some of the things that help with prenatal care, so getting certain nutrients, things like that, the infant mortality drops dramatically, and as well as more women living through childbirth, not having as many issues. So when you're having a vaginal childbirth, there's 3 stages. So basically, first the cervix dilates. So basically, it opens so that the baby can come out. And full dilation is 10 centimeters or 4 inches. The baby is also positioning themselves with their head down and starting to move further into the birth canal, which is going to be, which the mother is going to start feeling as pressure. The stage 2 is the descendant and emergence of the baby. So it's the baby actually moving through the birth canal and emerging. And then lastly, the stage 3 is when the mother expels the placenta. And so that can happen up to like an hour after the birth. And basically, she's just getting rid of the placenta and then any umbilical cord attachments that are left over. All right, so fetal monitoring is basically a system where they can check the fetus's heart during the birth. And there's some pros to it. If it's a high risk pregnancy, monitoring the fetus's heart rate could be really useful. But what's happened is we have started using it in almost all births. Oh, and it's got the statistic up there. So 89% in 2004 of live births were they were using fetal monitoring. And the problem is that it has an extremely high false positivity rate, meaning that a lot of times it will show that the fetus is in distress when really it's not. And what that means is that you have more women who then at that point are told by doctors that their fetus is in distress, and then they're kind of pushed into the cesarean experience, which maybe they didn't want. And then also, cesarean, which we'll talk about in a second, has its own risks and drawbacks. Fetal monitoring is also expensive. And then it also restricts the mom's movement. So if you're somebody who, when you're giving birth, you want to move around, or it feels better to move your hips and things like that. If you are hooked up to the monitor, you can't do that. You are regulated to your hospital bed, and mainly in one position on your back. So cesarean delivery, or C-section, is where you cut into the mother's abdomen and then take the baby out of the uterus. It's declined a little bit. Looks like we're at 32% in 2015. They are more common with large babies, and sometimes if it's your first baby, because you tend to have longer labor if it's your first baby, and they get worried about sort of the fetal monitoring the longer you're in labor. So I think like with cesarean, there was, this idea for a while that women wanted to be able to schedule when they were going to have their birth, that it wouldn't be as painful. It gives doctors some cover with malpractice, because if they have more control over the surgery than they would a natural birth, things like that. So there's a lot that goes into it, but a lot of this is discussed in the business of being born. So like I said, we'll talk more about that. All right, so a newborn, the first 4 weeks of life is called the neonatal period. And obviously this is where they're transitioning from being inside of the mother and getting all of their sort of nutrients, life, so oxygen, things like that, from their umbilical cord and their mother to this sort of independent existence. Obviously, we know that we're still like feeding them and stuff like that, but they aren't depending on a body anymore. So the average newborn in the US is 20 inches long and about 7.5 pounds. One of my friends had a baby a couple months ago, and it was 10 pounds, 10-pound baby. So that's obviously on the very high side. So body systems, babies start to breathe as soon as they are exposed to air, and definitely within the first 5 minutes. After that, there's starts to be the risk of brain damage for not getting enough oxygen to the brain. So that's why when you see in the movies, like them taking the baby out, they want it to start screaming as soon as possible, because that means that they're getting air in, they've started to breathe. Just so people know, I think this is important that maybe a lot of people don't know, about half, 50% of all babies do develop jaundice, which is a yellowing of kind of the skin and eyeballs within a few days after birth. And just, yeah, it's just normal. I think like particularly a lot of my friends have had kids by this point, and some of them have been alarmed by that, not knowing like how sort of typical it is. It's just due to the liver not being fully developed. And it's important to treat, but it's not life-threatening in any way as long as it's treated. Low birth weight babies would be classified as any babies less than 5.5 pounds. And so some of the, let's do this. Some of the factors that women will be at risk for an underweight baby is people who are having babies under the age of 17 and over the age of 40, lack of education and income, so poor nutrition, smoking and drinking, any infections, high blood pressure. You can see a lot of those things are strongly connected to socioeconomic status. And it's important to negate any sort of risk for underweight babies if possible, because there can be long-term outcomes. So later in life, low weight baby, low birth weight babies might have adult onset diabetes, heart disease. They could have cognitive impairments. Studies show that they tend to have lower academic achievement, and then social behavioral attention problems. So I don't think that these are things that are necessarily going to happen to every baby that has a low birth rate, but these are definitely risks, and there is a correlation between these risks and low birth weight. So definitely things to be on the lookout for. So stillbirths, you have a stillbirth when the fetus dies after 20 weeks of gestation. So, it happens for different reasons. There Sometimes you can figure out what the reason is, sometimes you can't. It can be obviously very devastating for people because you're so far along in the pregnancy, that yeah, it can be very difficult. Um, there's also the post maturity, so there is a risk for fetal health if women haven't gone into labor by week 42. And so most doctors, like, as long as you're like getting prenatal care, they're probably not going to let you go that long. Starting the 41st week, they're going to be really wanting to talk about, inducing maybe a C-section, things like that. So if you have access to good medical care, this is not the biggest risk because they're not going to let you get to 42 weeks. So when we want to reduce infant mortality, there are some things that we can do. One of them is vaccines. We'll talk about that in a minute. Having better prenatal care is really important. When we're looking at the number, let's see, 2015, almost 6 million deaths of children ages 5 and under. So that's a huge number. A lot of them are in developing countries. So having preterm birth complications, looks like that was 35% of the causes. That means that they probably didn't have adequate prenatal care. So that could be due to nutrition, diseases, all kinds of stuff like that. Childbirth complications. So that would be actually when the woman goes into labor, something is going wrong or there's a problem with that. And then sepsis, which is basically a blood infection. And then SIDS here is another risk. This is sudden infant death syndrome. And this is when a seemingly healthy infant under the age of 1 dies, usually in their sleep. And they know that a big factor of this is babies who sleep on their stomachs. Once they started advocating, doctors started informing and educating the public about having your baby sleep on its back, the numbers have dropped dramatically, number of SID deaths. So that's great that we have that information now and we're educating the public and people are learning. So I'm gonna stop there and I will talk about the rest of chapter 4 in a different video.